Hi everyone, Sabrina with Sage Health Insurance Services here for another episode of Medicare Unwrapped. Today we are going to talk about Medicare and Medicaid. So they sound very similar, but they are not the same thing. Medicare, as you've previously heard, if you've watched these videos, if you haven't, go back and watch some. There's some good, easy to digest information in here. Medicare is a government facilitated program for folks who are 65 years or older. There are other options to that. If you are on disability, sometimes that makes you eligible for Medicare, but generally speaking, 65 years or older. Medicaid, on the other hand, is for folks that are under a certain economic status, part of the federal poverty level, a certain percentage of that, which changes every year, that are eligible for, say, the Oregon Health Plan. Now, just because these are two separate things, Medicaid is not age restricted. You can be eligible for Medicaid as soon as you're born. Depending on your parents' income level, you can continue to be eligible for it up until you're 85 years old. So Medicaid does work with Medicare. So you can be Medicare eligible and still be eligible for Medicaid because you fall in that certain percentage bracket of the federal poverty level. That's the technical term for it. So if you don't make a certain amount of money, you're eligible for Medicaid. We see this occur in the form of subsidies. So like a low income subsidy can help pay for your Medicare premiums. We also see what's called a D-SNP. And if you haven't seen the video on that, make sure you take a peek. Very important. So dual special needs plan, which means you are eligible for Medicare and you are also eligible for full Medicaid benefits because you make under a certain amount of money. So these plans have very, very good benefits, often at little to no cost. And that would be the Medicaid part of Medicare. But they're not interchangeable. Just because you're eligible for Medicare doesn't mean you're eligible for Medicaid. And likewise, just because you're eligible for Medicaid does not mean that you are eligible for Medicare. So I hope this helps clear up a little bit of the gray fuzz that is surrounded by the Medicare industry. If you have any other questions, make sure you drop those in the comments, give us a call, shoot us a message. We want to answer the questions that you have. This is Medicare Unwrapped with Sage Health Insurance Services. My name is Sabrina. Make sure to like our page for more information. Thank you. Bye.